Are you searching for an effective and reliable treatment for depression? Look no further than Effexor. In this comprehensive review, we will explore the efficacy and potential side effects of Effexor as a medication for depression. Depression affects millions of people globally, causing a loss of interest in daily activities, persistent sadness, and a lack of energy. Effexor, an antidepressant, belongs to a class of medications called serotonin norepinephrine reuptake inhibitors, SNRIs. It works by increasing the levels of serotonin and norepinephrine in the brain, ultimately improving mood and reducing depressive symptoms. Throughout this review, we will delve into the effectiveness of Effexor in treating depression, discussing clinical studies and patient experiences. We will also address potential side effects to provide a comprehensive picture of this medication. If you are considering Effexor as a treatment option for depression, or if you are curious about its efficacy and side effects, this review will provide you with the information you need to make an informed decision. Let's delve into the intricacies of Effexor and its role in depression treatment. Effectiveness of Effexor in treating depression, research and studies. Effexor has been extensively studied for its effectiveness in treating depression. Multiple clinical trials have demonstrated its ability to alleviate depressive symptoms and improve overall mood. One study published in the Journal of Clinical Psychiatry found that Effexor was significantly more effective in reducing depression symptoms compared to a placebo. The study involved over 400 participants with major depressive disorder and concluded that Effexor led to a significant improvement in depressive symptoms, including feelings of sadness, loss of interest, and changes in appetite and sleep patterns. Another study published in the Journal of Affective Disorders compared the effectiveness of Effexor to other commonly prescribed antidepressants. The researchers found that Effexor was equally effective in reducing depressive symptoms when compared to other selective serotonin reuptake inhibitors, SSRIs, such as Prozac and Zoloft. This suggests that Effexor can be a viable alternative for individuals who have not responded well to SSRIs or prefer a different class of antidepressants. While these studies provide valuable insights into the effectiveness of Effexor, it is important to note that individual responses to medication can vary. It is always recommended to consult with a healthcare professional to determine the most suitable treatment plan for your specific needs. Common side effects of Effexor and how to manage them. Like any medication, Effexor may cause certain side effects. While most side effects are mild and temporary, it is important to be aware of them and know how to manage them. Common side effects of Effexor include nausea, dizziness, headaches, and changes in appetite or weight. These side effects are generally mild and tend to diminish as the body adjusts to the medication. To manage nausea, it is recommended to take Effexor with food or consult a healthcare professional for additional strategies. If dizziness occurs, it is advisable to avoid sudden movements and get up slowly from a sitting or lying position. Headaches can often be relieved with over-the-counter pain relievers, but it is important to consult a healthcare professional if they persist or worsen. Changes in appetite or weight are also common with Effexor. Some individuals may experience a decrease in appetite and subsequent weight loss, while others may experience an increase in appetite and weight gain. Maintaining a balanced diet and engaging in regular physical activity can help manage these changes. If significant changes in appetite or weight occur, it is important to consult a healthcare professional for further advice. Rare but serious side effects of Effexor. What you need to know. While rare, there are some serious side effects associated with Effexor that require immediate medical attention. These include allergic reactions, increased blood pressure, and serotonin syndrome. Allergic reactions to Effexor can manifest as rash, itching, swelling, severe dizziness, or difficulty breathing. If any of these symptoms occur, it is important to seek medical help immediately. Additionally, Effexor may increase blood pressure in some individuals, so regular monitoring is essential. Symptoms of increased blood pressure may include severe headache, blurred vision, chest pain, or shortness of breath. If any of these symptoms occur, it is important to consult a healthcare professional promptly. Serotonin syndrome is a rare but potentially life-threatening condition that can occur when there is an excess of serotonin in the body. Symptoms may include agitation, hallucinations, rapid heartbeat, high fever, sweating, shivering, muscle stiffness, tremors, and loss of coordination. If any of these symptoms occur, it is crucial to seek immediate medical attention. It is important to note that this is not an exhaustive list of side effects. If you experience any unusual or concerning symptoms while taking Effexor, it is advisable to consult a healthcare professional for further evaluation. Personal experiences with Effexor, testimonials and stories. Personal experiences with Effexor can provide valuable insights into the medication's effectiveness and side effects. While individual experiences may vary, hearing from others who have taken Effexor can help individuals considering the medication make an informed decision. Many individuals have reported positive experiences with Effexor, noting significant improvements in their depressive symptoms and overall well-being. These individuals often highlight the medication's ability to restore their energy levels, improve their mood, and enhance their overall quality of life. However, it is important to remember that personal experiences can differ, and what works for one person may not necessarily work for another. On the other hand, some individuals have reported experiencing side effects that were bothersome or intolerable. These side effects may range from mild discomfort, such as drowsiness or dry mouth, to more severe symptoms that required discontinuation of the medication. It is crucial to remember that everyone's response to medication is unique, and individual experiences may not be representative of the overall population. Alternatives to Effexor for depression treatment. While Effexor is an effective medication for many individuals, it may not be suitable for everyone. Fortunately, there are alternative treatment options available for depression. Selective serotonin reuptake inhibitors, SSRIs, such as Prozac, Zoloft, and Lexapro, are commonly prescribed antidepressants that work by increasing serotonin levels in the brain. These medications have been shown to be effective in treating depression and may be a suitable alternative for individuals who do not respond well to Effexor or prefer a different class of antidepressants. Other options for depression treatment include tricyclic antidepressants, TCAs, monoamine oxidase inhibitors, MAOIs, and atypical antidepressants. These medications work through different mechanisms and may be appropriate for individuals who have not responded well to other classes of antidepressants. It is important to consult with a healthcare professional when considering alternative treatment options for depression. They can assess individual needs and determine the most appropriate course of action. Important considerations before starting Effexor. Precautions and warnings. Before starting Effexor, it is important to consider certain precautions and be aware of potential warnings. Effexor should not be abruptly stopped as it may lead to discontinuation symptoms. These symptoms may include dizziness, nausea, headache, insomnia, irritability, and electric shock-like sensations. If discontinuation symptoms occur, it is advisable to consult a healthcare professional for guidance on gradually reducing the medication. Effexor may interact with other medications, including monoamine oxidase inhibitors, MAOIs, blood thinners, and certain pain medications. It is essential to inform a healthcare professional about all medications, including over-the-counter drugs and supplements, before starting Effexor to avoid potential interactions. Individuals with certain medical conditions, such as uncontrolled high blood pressure, heart problems, glaucoma, or a history of seizures, should exercise caution when taking Effexor. It is important to discuss these conditions with a healthcare professional to determine the suitability of Effexor as a treatment option. Tips for taking Effexor effectively: dosage, timing, and other factors. To ensure the optimal effectiveness of Effexor, it is important to follow certain guidelines regarding dosage, timing, and other factors. Effexor is typically administered in divided doses throughout the day. It is important to take the medication as prescribed by a healthcare professional and avoid changing the dosage without their guidance. Additionally, it may take several weeks for Effexor to reach its full therapeutic effect, so patience is key when starting this medication. Taking Effexor with food can help minimize stomach upset and reduce the likelihood of nausea. It is generally recommended to take Effexor with a meal or a snack, unless otherwise advised by a healthcare professional. Missing a dose of Effexor should be avoided, as it may lead to discontinuation symptoms or a decrease in the medication's effectiveness. If a dose is missed, it is advisable to take it as soon as remembered. However, if it is close to the next scheduled dose, it is recommended to skip the missed dose and resume the regular dosing schedule. It is important to communicate openly with a healthcare professional while taking Effexor. They can monitor progress, adjust dosages if necessary, and address any concerns or questions that may arise. Frequently asked questions about Effexor, answers and explanations. How long does it take for Effexor to start working? It may take several weeks for Effexor to reach its full therapeutic effect. Individual responses may vary, and it is important to be patient while waiting for the medication to take effect. Can Effexor be used for anxiety? Effexor is primarily prescribed for depression treatment. However, it may also be effective in treating generalized anxiety disorder, JD, and social anxiety disorder, SAD. It is recommended to consult with a healthcare professional for an accurate diagnosis and appropriate treatment plan. Is Effexor addictive? Effexor is not considered addictive. However, discontinuing the medication abruptly may lead to discontinuation symptoms. It is important to follow a healthcare professional's guidance when discontinuing Effexor. Can Effexor be taken during pregnancy? The use of Effexor during pregnancy should be carefully considered, as it may pose certain risks. It is essential to consult with a healthcare professional to weigh the potential benefits and risks before starting or continuing Effexor during pregnancy. Can Effexor be taken with alcohol? It is generally recommended to avoid or limit alcohol consumption while taking Effexor. Alcohol may increase the risk of certain side effects and may interfere with the medication's effectiveness. Conclusion: is Effexor the right choice for you? Effexor, an antidepressant belonging to the SNRI class of medications, has been shown to be effective in treating depression and improving overall mood. Clinical studies have demonstrated its efficacy, and many individuals have reported positive experiences with the medication. However, it is important to be aware of potential side effects and to consult with a healthcare professional to determine the most suitable treatment plan for your specific needs. Alternatives to Effexor are available for individuals who do not respond well to this medication or prefer a different class of antidepressants. It is crucial to consider important precautions and warnings before starting Effexor and to follow recommended guidelines for effective use. Ultimately, the decision to take Effexor or any other medication should be made in consultation with a healthcare professional who can assess individual needs and provide personalized recommendations. Depression is a complex condition, and treatment approaches may vary from person to person. With the right guidance and support, finding an effective treatment for depression is possible, and Effexor may be a valuable option to consider.